Hi dear students, I am Dr. Amjad. So today it is our third segment of the chapter, that is coordination and response. We have practiced questions from our first part, that was the nervous system. Then we have also practiced questions from an eye, and this is the third one, which is from hormones. So let's start from first MCQs, that is, what is a role of adrenaline and where is it destroyed in the body? So the role of adrenaline is, according to this, there are many other roles, but according to this question and the available options, the role of adrenaline is to convert the glycogen into glucose. So it means glycogen change to glucose. This is one of the functions of the adrenaline. Where it is destroyed, it is the second part of this question. Where it is destroyed when it is not required at the end of the function. So it is destroyed in the liver. So by having these two concepts, option D is correct. In option D, glycogen changed to glucose and destroyed by liver. Let's move on to the next one. A patient complains to the doctor of unexplained weight loss, severe thirst and frequent need of urination. A test shows high levels of glucose in the urine. Which condition does the doctor diagnose? Option A, cardiovascular disease. Option B, diabetes. Option C, kidney failure. Option D, obesity. So in the question, three symptoms of diabetes are mentioned. One is weight loss, severe thirst, and third one is frequent need of urination. Whenever these three symptoms are present in any person, he or she is the patient of diabetes. So option B is correct. In MCQs 3, what are the symptoms of diabetes? Again, concentration of glucose, because it is the main symptom, and when it changes in the blood or it increases in the blood, so why urination is the main symptom, or frequent urination is the main symptom in the patient, because more glucose level is in the blood. So the body of that the body of the patient having diabetes will not be able to control the glucose level in the blood. So as a result, that is filtered by the kidney. So that's why that person feel frequent need of urination. So in this MCQs, concentration of glucose in the blood, in the urine, examiner has given you a key, that is plus shows increase and minus shows decrease. But in case of concentration of glucose, it is increased in the blood as well as it is increased in the urine. So definitely when the glucose level that has increased in the blood, that's why patient of diabetes is feeling a frequent need of urination. So it means when the glucose level is increased in the blood unnecessarily, so the kidney cannot reabsorb that glucose. So as a result, that glucose, which is the part of filtrate, will remain in the kidney tubules, and at the end that will secrete out from the body in the form of urine. So it means that the concentration of glucose is increased in both cases, in blood as well as in urine. So here the option A is correct. Option A is correct because the glucose level or the concentration of glucose is greater in the blood or increased in the blood as well as in the urine. Next question. What are the cause, signs and symptoms and treatment for diabetes mellitus? What is the cause? Cause, signs and symptoms, treatment. Cause is main cause. There are definitely the diabetes mellitus that may have because diabetes 1 and diabetes 2, these two types of diabetes there. But what is its cause? Its cause because damaged pancreas cells, because we know that there is a hormone which is called insulin, which is released from the beta cells of the pancreas. If the pancreatic cells, if the pancreas damaged because of any reason, so as a result excess sugar will be in the blood because insulin will not be released, right? So when excess sugar or sugar will excess in the blood, so ultimately that will release in the that will also be present in the urine. So urine test actually shows that the glucose level or glucose is present in the urine. Normally glucose has to be reabsorbed by the kidney when it's going on or it is processing there in the kidney during the urine formation. But the person who is a diabetic patient, in that case kidney cannot reabsorb that glucose, so as a result that will remain in the urine, right? And the treatment is injection, insulin injection. We always use insulin injection for that person who is a diabetic patient. So here option B is correct, damaged pancreatic or pancreas cells. Sign and symptoms is urine, there is a sugar in the urine, and the treatment is insulin injections. So option B is correct. I hope you're getting this point. So then we have question number 5. Insulin is a hormone, as we know, synthesized in the pancreas. Yes, it is synthesized in the pancreas and is distributed around the body by the blood. Yes, it is distributed by the around the body by the blood. What describes its rate of secretion and its concentration in the blood? So we have to choose from here. Rate of secretion. So examiner asked you this question, that what is the rate of secretion of the insulin in the body? So definitely that is not constant, that is variable, that is different according to the situation. When more glucose present in the body, so more insulin will be released, so it is variable. Concentration in the blood, so definitely its concentration is also variable. So when the rate of secretion is different, so definitely its concentration in the blood is also different. So here without any other second thought, option D is correct, varied. Another question, that is, in a person suffering from diabetes mellitus, how do the concentrations of glucose in the blood and in the urine differ from those of a healthy person? In a person suffering from diabetes mellitus, how do the concentrations of glucose in the blood and the urine differ from those of a healthy person? So again, it is very same question like we have discussed earlier. Concentration of glucose in the blood, definitely that is higher. The concentration of in a person suffering from diabetes mellitus, how do the concentrations of glucose in the blood and in the urine differ from those of the healthy person? So definitely the concentration of glucose in the blood is higher, and similarly the concentration of glucose in the urine is higher as compared to a normal healthy person. So option A is correct. Which of these is a sign of diabetes mellitus? Yes, which one? Raised blood glucose levels. Raised blood glucose levels. That's very simple. Diabetic patient or the diabetes mellitus, the first sign is person has normally 3 to 400 you can say the glucose level. In a normal person that is about 80 to 120 or 150, but not more than this. But in case of a diabetic patient, the diabetes mellitus, it is raised the blood glucose level from the normal person. A person with diabetes mellitus is receiving treatment with insulin injections. The graph shows how this person's blood glucose concentration changed during part of one day, and what point was an insulin injection given. Okay, from this you can find out blood glucose concentration, arbitrary units, it is on y-axis, and on x-axis you have time. So here 4 options A, B, C, D. So just concentrate on the question. At what point was an insulin injection given? At which point you are going to give the insulin injection? At what point was an insulin injection given? Okay, so at what point that the insulin injection is given. So just find out this from A, B, C and D. Listen, that's very simple. Here is the point A, which is above from the normal. So at this point the insulin level, insulin is given to a person, right? So then it is declining by injecting insulin. As it is declining, so to the normal, and definitely that may reduce if that person is not taking glucose up to the optimum level. So B and C both are below the normal concentration, and that is hypoglycemia, and D is also there. So again from D it's a point D, and then it's also rising. So at because we have only 4 options here, A, B, C, D, so we will select A, because at the point A insulin injection was given to a patient. So here option A is correct. What decreases as a result of adrenaline secretion? There are many changes which occur in the body due to the secretion of adrenaline in the body, that may raise the heartbeat, may raise the blood pressure, and some other changes in the body. But here digestive activity that becomes decreases, because the blood which was actually normally delivered to the stomach or the digestive system, that diverted towards the muscles because of the fight and fright conditions. When flight and fight or fight condition is there, so at that time the blood which is normally used by digestive system, that is diverted toward the muscles in order to perform or to react on that situation. So that is why digestive activity becomes decreased. So option B is correct in this case. I hope you are getting why digestive activity is decreasing. It is decreased because the blood which is normally used by digestive system, that is diverted toward the muscles in order to respond that emergency situation in because of the secretion of the adrenaline. 10. How does adrenaline affect glucose uptake by muscle cells and carbohydrate conversion by liver cells? Glucose uptake by muscle cells. Glucose uptake, will it increase or decrease? So definitely it will increase, because glycogen is converting to glucose. So in this case option D is correct, because when adrenaline is secreted in the body, so as a result it always always increases the concentration of glucose or uptake of glucose to the muscles, because muscles are in function, or they are involved in the response in emergency situation. So the second, carbohydrate conversion, so definitely glycogen is converted to glucose. So option D is correct in this case. So dear students, the next one is adrenaline is secreted quickly when a person is frightened. How does this affect the heartbeat and the liver? So heartbeat, definitely heartbeat will increases. Heartbeat will increase. So heartbeat increases because greater pressure or blood pressure is required in the body in order to respond in the emergency situation. And the muscles, because muscles are active, so they require more blood during that time. So that's why heartbeat increases. Liver converts, so definitely liver converts glycogen to glucose. So option C is correct here. In this case, heartbeat increases. Remember, when adrenaline is secreted in the body, so it always increases the heartbeat for greater or for more pressure or more blood pressure in the body, because it is the requirement of the muscles. And the second thing is, what is the function of liver at that time? So liver always converts glycogen to glucose, because the urgent source of energy is glucose, and that is required by muscles when they are performing that activity, any specific activity in a frightened condition or in the shock condition. So option C is correct. The graph shows changes in a person's blood glucose concentration over 4 hours. Right? You can keenly observe this graph. Here you have blood glucose on the y-axis and time of 2 hours on the x-axis. So what might cause the changes at x and y? So here you have 4 options. You can observe here first this graph. At point x, the curve is declining. At point y, the curve is rising. So what type of changes are here? Blood glucose at x you have increased insulin. That's why the curve is declining at the point of x, while at the point y, what it shows the blood glucose level is rising, and it is rising just because of that the secretion of adrenaline. So it means y is the point where increased adrenaline, and x is the point where increased insulin. So option B is correct. Right? Next question is, what is a sign of diabetes mellitus? Again, the very same question. Glucose in the blood. Glucose is always in the blood. If the concentration of glucose is rising there in the blood, so then it's a diabetes mellitus. But glucose is always in the blood. Glucose in the urine, insulin in the blood, and insulin in the urine. So option B is correct here, because the person who is the patient of diabetes mellitus, I said many times before that the glucose level or the glucose concentration will become the part of B is correct in this case. What changes occur in the body when a person is shocked? Okay, so what increases? Increase in diameter of the pupil in the eye, decrease in the speed of the peristalsis. Shocked is actually, he has just changed the statement here, otherwise it's the very same question. When somebody shocked, frightened, or in a fight or flight condition, so there is a release of adrenaline there. So as a result, there are many changes which occur in the body, like the pupil size, the diameter of the pupil is increased in the eye, and the second thing we have discussed one of the MCQs is one of the options where we said the digestive system or the digestion process decreases. So digestion process decreases means when that will be decreased, so definitely at that time the speed of the peristalsis is decreased, because peristalsis is actually the sequential contraction and relaxation of the digestive system or the muscles present in the digestive systems, right? So when the person is in a shock condition, most of the blood that was normally that was the part of digestive system will be diverted toward the muscles. So there the blood is required in greater concentration because of the activity which is performed in the emergency situation. So here the speed of the peristalsis will decrease. So option A is correct in this case. The graph shows changes in the glucose concentration in the blood of a person during 2 hours. What explains the shape of the graph after X? After X, remember, after X, not at point X, after X. So here option A should be correct, because after that we can see that the curve is rising gradually, which shows that the diabetic patient, the person has eaten a sugary food, has eaten something which was rich in glucose, or which that food which is enriched with glucose. So here we can say from this graph we can predict that the person has eaten a sugary food. So that's why the curve is rising gradually. So here option A is correct, dear students. Let's move to the next one. What is the function of adrenaline? We have attempted many questions on it. So what is the function of adrenaline? Its function is to convert glycogen into glucose. So here option A is correct. When a person is frightened, which responses will occur? Again, when somebody is frightened, it is also from the it is a question which is from adrenaline. So here adrenaline released, okay, that will release. Heartbeat increases, yes, heartbeat increases. Eye pupils dilate, yes, that will dilate. Yes, okay, so option A is correct. You can read other three as well, but here option A is correct. When a person is frightened, which substance increases the blood sugar level? When somebody is frightened, so which substance increases the blood sugar level? So definitely that's adrenaline, because we have studied that adrenaline or its secretion in the body will increase the conversion of glycogen to glucose, right? So as a result, the glucose level will increase in the body, because that provides energy to the muscles to perform their function. So here option A is correct. Alright, so that's all for today. I think we have completed this section. So thank you very much. Stay blessed. We will we'll meet in the next video with paper 2, because we have to practice paper 2 of this chapter. So this is how we will practice in this month, because in May, June you people have to be appearing your exam. So we have to practice most of the chapters from here onwards, and especially paper 1 and paper 2. Then we'll talk about the alternative paper. Thank you very much.